When performing McRoberts maneuver, 2 assistants are needed. Often this can be with the assistance of lay people in the room. Each one grabs the legs of the mother and lifts them, and rotating her thighs back on the abdomen with her knees towards her chest. This action rolls the pelvis up off the end of the bed in an attempt to get the pubic bone to lift up and over the shoulder. When performing suprapubic pressure, it's important to direct the assistant which side to apply the pressure from. In this instance, the baby's back is towards the mom's left, and so we want suprapubic pressure to come from behind the baby's top shoulders scapula from the mom's left side, as so. The goal is to try to get the shoulder to roll over away from the provider towards the diagonal diameter in the pelvis. What's happening inside is that the anterior shoulder is being rotated from its anterior posterior dimension to the diagonal dimension so that it can deliver. When delivering the posterior arm, it is important to get the entire hand behind the baby's head and into the vagina, grasping the posterior shoulder and rotating it to the oblique position. The fingers are used to trace up to the elbow, and the arm is flexed across the baby's chest and the arm is pulled out ahead of the body. Rubin's maneuver can be done in one of 2 ways. Either the anterior shoulder can be rotated or the posterior shoulder can be rotated. We will first demonstrate rotating the anterior shoulder. With attempting to insert as many fingers as possible anteriorly to get behind the baby's scapula, the anterior shoulder is rotated towards the baby's chest. Often it is difficult to gain adequate access to the anterior shoulder, so an alternative is to rotate the posterior shoulder in the opposite direction. In rotating the posterior shoulder, the anterior shoulder is now rotating in the opposite direction to that which suprapubic pressure was attempting. Therefore, suprapubic pressure should be stopped. Wood screw is an attempt to bring the posterior shoulder 180 degrees to the anterior position, and it will end up in front of the pubic bone rather than the anterior shoulder being behind the pubic bone. Just as in delivering the posterior arm, the entire hand should be inserted behind the baby's head, and then the other hand can be used to help move the anterior shoulder until the entire baby is rotated 180 degrees. This corkscrew fashion ends up with the anterior shoulder in front of the pubic bone. Considered a maneuver of last resort, cephalic replacement, also known as Zavanelli, is done to push the baby back up inside the mother's uterus, and then an expeditious cesarean section is performed. This is more difficult than it may seem. What's necessary is to first re-rotate the baby's head back to the direct OA position. The head should be flexed against the maternal perineum and then gently guided up and back inside the vagina and up inside the uterus.